Welcome to Case Closed, a risk management series that examines real malpractice cases so podiatrists can learn what went wrong, how it was defended, and what steps can reduce risk in their own practice. In this case, a surgical repair of a Charcot foot led to a below-the-knee amputation, the patient's death, and a wrongful death lawsuit against the insured podiatrist. Here is how the case unfolded and what every podiatrist can take away from it. A male patient in his late 40s came to our insured podiatrist with a serious history: type 2 diabetes, obesity, diabetic neuropathy, and a non-healing wound. He had been treated at a wound care center for several years before being referred for evaluation. The insured diagnosed him with a DM2 Charcot joint and non-healing wound. The insured performed a surgical repair of the Charcot deformity. The surgery went smoothly and without incident, but the recovery did not. Multiple recurrent wounds developed post-op. Nearly 4 months later, a SIME amputation was performed. A week after that, a below-the-knee amputation was necessary. 2 months later, the patient was admitted to the ER with tachycardia and a massive pulmonary embolism. He passed away 9 days later from cerebral edema. The patient's family filed a wrongful death lawsuit against the insured, also alleging negligence. The defense built a strong case. An expert witness used the patient's own medical and hospital records to show that the cause of death had no connection to the care the insured provided. The podiatry experts, with specialized knowledge in Charcot and infectious disease, submitted compelling reports. The defense also used the deposition of the patient's wife, which confirmed patient noncompliance and a subsequent trauma that occurred after the patient's last visit with the insured. The case resulted in a unanimous verdict in favor of the insured. Here are the risk management takeaways from this case. Document informed consent thoroughly for any surgical procedure. When a surgery is a salvage procedure that carries a significant risk of amputation, that must be clearly stated in the consent form. The patient needs to understand the risks before agreeing to treatment. Bring in family members and other treating providers during the informed consent and treatment planning process when you can. In cases involving a non-compliant patient facing a time-sensitive, limb-saving procedure, coordinating with the patient's family physician, specialists, and family can reduce liability exposure. The insured did this and documented it well. Be specific in your progress notes. This case included consistent documentation of pain complaints, but noting that the pain was neuropathic and pre-existing would have strengthened the record further. Use caution with the term dehiscence in your documentation. When you use it, clarify whether infection is present or absent. Note the size, depth, and likely cause of the opening. Document the recommended course of care. Specificity protects you. Every case holds a lesson. This one reinforces that thorough documentation, informed consent, and proactive communication with patients and their families are among the strongest defenses a podiatrist can have. To learn more about protecting your podiatric practice, visit our website to download this case study today.